Hello, and welcome to JA Explained. This episode is all about helping your child or teen with JA juggle the emotional challenges of having a chronic condition like arthritis. My name is Jeanne Proefrock, and I myself am a JA parent. My 13-year-old daughter was diagnosed at age 2 with polyarticular JIA. Our guest today, Dr. Jessica Auslander, will share advice on how we as caregivers and parents can help our kids navigate the highs and lows of having a chronic illness. Dr. Auslander is a licensed clinical mental health counselor, psychologist, and JA parent who has been living with arthritis since age 8. So she understands this topic through and through. Dr. Auslander, thank you so much for joining and welcome.
Thank you very much for having me.
How do parents themselves, and this is huge for, I would say, any parent, but I know it as having 11 years of this disease under my belt and watching it go, what is your advice to encouraging someone like me as a parent, how to take care of myself when I spend the majority of my time not only taking care of my child, but living her disease, advocating for her disease, volunteering for ways to help bring in funds for research my whole life has been around, and you know this because our connection is through the same place, through the foundation. But how do you encourage a parent to also take care of themselves and make sure that they're making space for themselves?
Yeah, that's just that. You just mentioned that first step. Make the space, make the time. From a family perspective, it's doing things that are a balance between JA and not JA, right? So things that maybe have to be accommodated and things that aren't. So just having time that feels more, quote, normal, where you're not focusing on it. And then individually giving yourself downtime, giving yourself that space to get back to who we were before we were parents. I know it's a shock. We were human beings before we became mothers. But diving into old hobbies, old interests, anything that makes you feel more you need to come up for air. You need to be doing that. Seeking counseling too, great resource because I love that you brought up the siblings because one of the ways I kind of get siblings wanting to engage in therapy, I'm like, can you imagine a place where you can go and talk about your brother and sister and like they don't know about it and no one's going to tell them what you said? You're like, oh, best day ever, right? Same for us. We need a space where we can talk about our kids, our family, our dog, our job, whatever, in a non-judgmental, neutral, supportive space, right? It can be very, very powerful. Self-care is going to look different for everybody. I am never the therapist that says drink water, do yoga. That may not work for you, right? Rage room's a great option. Anything that's going to be an outlet. You don't know how much you need it until you take it. So it's saying no to things and recognizing the world's not going to end. You are not going to be an individual solution to a systemic problem. You are not going to cure your child's JA. But I can tell you, as a kid who's lived with this now for 36 years, I just turned 44 yesterday, so 36 years, I turned out okay. Yeah, it was a part of me. It didn't write my story. It didn't determine everything. So as a parent, when my oldest was diagnosed at 5 with that one swollen knee, I was on edge because I had a bad experience with it. Raising my child, both my JA children now, with the resources, it's not as scary as it used to be. The rate that the science is evolving is mind-blowing, absolutely mind-blowing. We go to Summit and we talk about here's what my mom went through raising me versus how I'm raising my kids. And we're talking a 30-year time span at best. It's mind-blowing. So it's also finding those little glimmers of hope. If I can give one of the reasons I became so involved with Foundation Summit is I hope I can give people a little bit of hope and that little bit of like, hey, look at me. I'm at the cross section of the science. And there's not much I can't do because of it. And ankylosing spondylitis is one of the kind of nastier versions that tends to cause permanent damage fairly quickly. I can do most things I've wanted to do. I'm going back into running. I'm very active. I zip line. I do all this stuff that I was told as a kid I'd never be able to do. I'm doing it as an adult. When we look at how to take a break as caregivers, it's also realizing that there's some hope to be had. We're not going to solve this in our child's lifetime, but quality of life does not mean there's no arthritis. The two can coexist. And taking down our own fears, We want our kids to be healthy and happy. Just because they have JA doesn't mean they're not going to be.
Yep, that makes a lot of sense. So are there we've talked through a lot of subjects, but are there other like specific resources that you'd recommend for parents seeking other guidance or support of their child's health, emotional health especially, when it comes to their chronic pain?
When we look at specific resources for coping, we use a lot of cognitive behavioral therapy, or looking at how our thoughts and our feelings interact with our behaviors. We can look at biofeedback. We can look at, if our nerves are just a little more active because there's pain signals, then maybe that's reflected in my heart rate. Maybe that's reflected in nerve conduction. There's a lot of other ways to get at it from looking at the body. Mindfulness-based stress reduction, MBSR, is another fantastic tool. Anything involving mindfulness is good. But it's remembering that pain is sensed in the brain. Some pain can be mind over matter. One of the biggest strengths I had being a JA kid, because I didn't have treatment options, was learning how to kind of mentally dissociate or block my pain and cope with it that way. For some kids, that might be more physiological, neurological. There's active swelling, there's more going on. And it's a combination of balancing the mind and body. So, looking up anything that is mindfulness, you can Google the term mindfulness. There's a lot of great books out there. You can even get them on Amazon. Mindfulness for Teens, What to Do When I Worry. Just Be, all of these kinds of mindfulness based books and workbooks for kids are out there. They are written in a way that the chronic health doesn't have to be a factor, right? These are just teaching mindfulness skills, teaching breathing, teaching self-awareness. You can talk to your doctor if they have specific resources. This is where resources really vary. I know we do not have enough pediatric rheumatologists to begin with, and not every clinic is created equal. Some may have access to mental health resources, others may not. But you can always ask your doctor or your pediatrician for specific referrals. But anything that's going to help positive social connection, anything that can do mind-body connection work, these are things you can do at home. You're basically helping your child learn what's the issue, what works for me, and how can I do it on my own? Do they need to breathe? Do they need to go beat up on a pillow? Do they need to use their words? Do they need to use artwork? Do they need to use humor, right? These are all very accessible little resources you can start doing now. The other, the main specific resource that I love to remind parents is the Arthritis Foundation. I can't tell you how it makes me feel so happy as a JA kid and a JA parent to see the progression of this organization and the resources they provide. So looking up those connect groups. I'm in a connect group for my high schooler. Both my JA kids are in high school now. I'm in that connect group for the high school set, and I'm still getting great resources and just connecting with other parents.
Any last words of advice or encouragement that you'd offer to parents? We all want our kids to be happy and healthy and obviously know how to handle themselves and be emotionally strong, but we all know that there's ups and downs in life. So do you have any last words of advice?
I talk about living in the and, not the or. It is not flaring or healthy. It is not pain or no pain, right? It's going to be a hybrid and a combination. We talk about good days and bad days. I mean, I can look back and I've got good minutes and bad minutes, or good hours and bad hours. As a kid, I remember starting my day feeling lousy, but by the end of it, I felt like $1,000,000, right? And we don't know why. So it's kind of letting go as much as you can, right? Of trying to have the answers, because you're never going to have them because they're within your child. And it's up to your child to learn themselves, and up to your child to start to advocate. You can't fix everything, right? We don't want to, because you're not going to be there all the time. We want the kids to have their own skills. So I guess the best piece of advice I can give parents is really take it one day at a time, but find a way to accept that your child is going to have a very varied experience, right? You're going to have a very unpredictable experience with it, and that's okay. Getting comfortable being uncomfortable, accepting that they can be in a flare, but still have a good day. Or they can be in medicated remission and still be having issues with anxiety or depression, right? Letting things combine versus thinking that things are on this list to check off, or that things are are contradicting each other. We don't want extreme thoughts because that leads to extreme feelings. And then the absolute last piece of advice I'm going to give is get your child talking, keep them talking, not for your information and your benefit, but to reflect and help them figure out who they are and let them tell you who they are. If it is chronic pain related or anything else, if it is how they're learning in school and suddenly they have an issue learning in school. We see a lot of ADHD come up in middle school and kids don't know how to talk about that, or different choices they may have socially. In middle school, the brain's kind of prune. It's called pruning, where they just have fewer interests. And a lot of kids are upset or afraid to tell the parent they don't want to play football anymore, right? Those kinds of things. Let your kid have that ability to just bounce things off of you and you be as neutral as possible to help them figure it out. Let them do the work for you. And then, keeping in touch with the Arthritis Foundation, all the resources, and then reaching out for your own support when you need it. If it's from another JA mom, or if it's from, a professional, in your community.